we're back to Health Hacker Life. TJ Anderson here, your host, joined with an amazing new guest, Dr. Stephanie Canestraro, founder of the Vegas Clinic. And I'm pronouncing that right?
Yeah, you got it.
Awesome. Out of Toronto. And welcome to the show. Excited to have you.
Thank you. Thanks so much for having me. We've been trying to do this for a while, so we did it.
Yes, we did, right? I took a long hiatus and I've now got my built out podcast studio in an alternative universe. Maybe you and we get together for an in-person interview at some point if you ever make it out to Colorado. But for context for our listeners, how we got connected, both of our companies were actually featured in the same ESPN article a couple of years ago for working with NHL players, with pro athletes on optimizing health overall, with a big focus on functional medicine, which we'll dive into today, as well as targeted, customized nutrition, which is the focus of our business at Elevated Eats. And so I know you work with a lot of athletes. Well, I'd love to unpack what that looks like, the trends you see across the board with pro athletes, et cetera. But before we get into that, I'd love to hear a little bit about the origin story of the Vegas Clinic and also why the Vegas Clinic, and maybe you can clarify for those that aren't clear on the spelling of Vegas and the meaning behind it.
Yeah. Okay. So, my clinic's called the Vegas Clinic, which is the vagus nerve, VAGUS. And it's your 10th cranial nerve. It's a very powerful nerve for helping your entire body, your immune system, the way you digest, your gut microbiome, everything. And it touches almost every organ. And for me, the reason that I named my clinic the Vegas Clinic was because I felt as though mine was hijacked. So all of everything that I've done, even while working with athletes, has been kind of guided by my own health journey, or lack of health, I should say. So in 2010, I was sitting watching a movie and all of a sudden I felt hijacked, like severe anxiety, wanted to jump out of my skin. And it catapulted into this. My face was paralyzed for a day. I was in and out of the hospital and eventually tentatively diagnosed with multiple sclerosis, which the tentative diagnosis was there because I had one plaque in my brain. You need to have 5 plaques or something for it to be diagnosable, right? So they're like, okay, we'll wait and watch. And I was like, that sounds weird. And I'm going to dive into the why. So, it's really taken me until now to really figure out what happened. Not until now, until 2021, to figure out specifically what happened. Because like I said, I felt hijacked in that moment. So your vagus nerve is responsible for rest and digest. And I went directly into this sympathetic state, which is your fight or flight. And I stayed there for years. And I worked away at my health and I thought I had found the answer. Parasites. Parasites are what hijacked me. That's what happened, because treating parasites, I got into a stable state, everything regulated. I was living a healthy life. And in 2021, it happened again like that, at a point where I felt the healthiest I had in my life. I was hijacked once again. And it turned out what I had missed was Lyme disease. So neuroborreliosis. And if you look at my symptoms in 2010, it was textbook neuroborreliosis. So technically, it should have been caught, because it was literally, if you look up neuroborreliosis on Wikipedia, like I had every symptom. So this time, though, it involved my heart. And this time I was equipped with a lot more knowledge. So it affected every organ in my body. So I had to learn how to support each organ, drain each organ. I had to learn how to get my destroyed gut back, my vagus nerve back online, but in from a place of knowing and understanding what was happening to each of those organs. So it was a very powerful, humbling, and also informative crash course into things that people don't understand about our body and different ways to go about healing your body.
Alternative approaches that aren't typical in maybe Western medicine and the average person doesn't have a lot of guidance on. You had to kind of go through that yourself, starting early on 2010 and then again in 2021. So Lyme was confirmed then. You were what? So bitten
Mine was
by
confirmed.
a Lyme.
No, I wasn't bitten by anything, and this is a
Okay.
misconception. That's not true. Mosquitoes can carry Lyme, right? I at that time though, and I mean, I was a student, but I was in a nice building, but
Mhm.
they had bed bugs. They got just like bed bugs can be anywhere. So I learned that that could be a vector, and that happened right in line with that place. Like I left that building right at that time because it was in my fourth year of chiropractic college. So there's different vectors. There's like I had dry socket though at the same time. So dry socket, I got my wisdom teeth out, didn't know, it's not a great thing to do. Now I know more about oral health and above the collar infections and all of that. They weren't really bugging me, but it was just a thing. They're like, you need your wisdom teeth out. So they took my wisdom tooth out and I actually got dry socket. And what happens is the collagen they put in there or the scab that's formed like breaks apart and it's every pathogen in your mouth has access now to it's passing your blood brain barrier. It has straight access through the nerves to your brain. You have different spirochetes in your mouth. You have spirochete is the type of bacteria that Lyme is. So Borrelia burgdorferi is the cause for Lyme disease. And it's a spiral shaped bacteria. The reason it makes it so dangerous is because it can corkscrew into things, but it can also shape shift and be in different forms in your body where it evades your immune system. It changes your immune system. It can infect your vagus nerve. Like it goes into the joints. So people have a lot of joint pain a lot of the time with Lyme. It likes hyaluronic acid. So that's one of its fuels. So that's living in your joints. But what I realized is I had these symptoms even on and off for my whole life that suggests that there was some sort of co-infection there, like which are other infections from Lyme. So you can also get Lyme in utero, which means that can be passed from mother to baby, but it can go never into an acute state. It's just in a chronic state for some people where you just have strange symptoms or your anxiety is the only symptom that you had, but your anxiety's root cause can be in part Lyme. So understanding that it can create different symptoms based on your immune system at different times in your life in different parts of your body is something that makes it very elusive to a lot of practitioners that don't understand it. But it also comes along with it that something called co-infections. So there's these other stealth infections or infections that people have all had in the past. Like have you heard of mono or
Yeah,
EBV?
I think I may have had it in high school.
Yeah, most people have. So that can stay in your body in kind of a latent state. And then if Lyme dysregulates your immune system or some other similar bacteria, then or parasite, then those viruses can become more active. And then you've got like this toxic soup happening. And then there's just like a slippery slope of very confusing reactions that happen in your body and lead to just this huge symptom pattern that is very hard to decipher for especially for a conventional because they don't look at the body as a whole as like one part can affect another and one of the ways that one part affects another is the vagus nerve. So just kind of like tying in all together these kind of complex processes to something more simple and then helping people kind of peel back the layers so they can regain their health is kind of what it guided me to.
Right. Wow. And it started with the gut. And so you mentioned a little bit about the what the vagus nerve is
Mhm.
and its connection to every organ in the body and its big connection with the gut. So talk a little bit about um, your approach on the gut. Like, what does your practice look like now in terms of helping people from a testing perspective, and specifically as it relates to the gut? Like, I'm really passionate about that for just myself. I've done a lot of gut testing. I just sent in my last round of poop to see if I've killed off a few things that I had that I found, and so like I'm always looking to work to optimize gut because I know the effect on immune system, energy, recovery, injury risk, et cetera. Right? It's a long list of things that the gut is connected with.
Yeah, the gut is powerful. It's considered outside of our body because once it gets into the bloodstream is inside. So you have access to it because you can change what you put in your mouth. You can use different herbs, you can use different modulators of your immune system, and you have access to it. So your gut microbiome communicates though with your vagus nerve through some of these bugs. So showing some people have lack of certain good bugs, they make less of these calming GABA, which some people know about is like your calming neurotransmitter. We know when someone has like a gut infection or if they have a parasite, they can be very anxious because all those toxins can access the vagus nerve or get into the bloodstream and cause increase in blood pressure because your body's trying to flush out toxic load. Every reaction of your body is a reaction that is trying to accomplish something to help you, right? We're prone to shutting down these symptoms, and I'm not saying to keep these uncomfortable symptoms going, but the gut lining is what protects us. So you asked what we do for testing. So for testing, we do stool testing, which you said you just sent yours in. There's a bunch of different stool tests. It's changed through the years, which ones we've used. Right now we're doing vibrant testing, but there's a lot of limitations to gut testing, but there's a lot of pros. There's a lot of things you can find out, right? Like gut inflammation. How well is your liver digesting your food? What's your short chain fatty acids look like? What is your good microbiome look like? That's your soil. The richness of your gut microbes is what you said, like helps protect the rest of our body. But where are those microbes? That makes a difference, because if some are in your small intestine that aren't supposed to be there, those are detrimental. Why are they there? Why are they in the small intestine? Is there a problem with your valve? Is there a parasite that's causing some sort of gastroparesis at certain parts in your bowel? Are they in your liver? So you're not dumping the bile to digest and break down where you should. So it gives you a lot of information on that side, and it gives you very, very specific clues for if there is a parasitic infection, but it can miss parasites. So stool tests, most of them are these DNA tests, right? So they're doing a PCR test to test for DNA. But parasites have evolved for time before us, right? And parasites dissolve their own DNA. So if you were to have a stool test and the stool was tested within 15 minutes, it takes 15 minutes for them to dissolve all of their DNA. So, or if you have a high enough load that they don't get a chance to break down all their DNA, then you'll find the parasites. So if you see a parasite on those stool tests, then you have a very high load. But I guarantee you some are still missed, right? So we say, my friend who owns Cellcore has a quote where it's, if you have a pulse, you have a parasite. So it's not a question of if you have the parasite, it's what's your parasitic load? Why is your load so high? So what if parasites thrive in an environment with toxins, heavy metals? They can harbor and eat things so in some ways they can protect us but they still give off their own waste. So it's not like having a good bacteria that ferments something, gives off something good, but they can be there present because they're trying to, or they thrive in those toxic environments. So that's when you have to detox, which includes, not only just supporting the liver, detoxing maybe bad people from your life because stress thins your gut lining. We can go down different rabbit holes, but, you want to help support the body and create where parasites don't want to thrive. And we also like to kill parasites because we've seen huge changes with eradicating them. But whenever we kill parasites, we know that we have to bind up the parasite's waste. We have to bind up the waste that after that parasite dies that it gives off. We know we have to upregulate detox. And one of the things that I find like frustrating is when everyone's like, oh, you don't need to detox, you're always detoxing. Well, people's detox, if you look at their livers, they're pretty terrible now. We're being inundated with toxins at a higher level than ever, faster than our DNA or our gut can catch up with. Glyphosate is a good example. So glyphosate is Roundup, right? And we like healthy food, so we don't want that on our food. It's really hard to not have it at all on our food or in our environment. But glyphosate acts like the opposite of an antibiotic. It kills your good bacteria and leaves pathogenic bacteria to thrive that make toxic things for our body. So you can see that in the stool test and you can help rebalance that, right? You can you can upregulate the bacteria that helps you break down glyphosate or break down heavy metals or break down. So we're trying to optimize the gut so that you don't, first of all, accumulate way too many toxins. We're supporting the liver because the liver is a huge part of your digestion and your pancreas and, your stomach acid and your chewing and your all of that. So, and supporting the gut immune system because that gets fatigued, but you can see all that in a stool test. So you get some really, really, really in-depth information about the gut. And then we use other ways to find if there's actually parasites, or you can do a general kind of parasite cleanse to help anyone, like really and truly.
Right. Right. Interesting. So if you have a pulse, you've got some sort of parasite load. So just because your gut test results don't indicate a parasite doesn't mean there's not a parasite in there.
Mm-hmm.
I think that's a good thing to mention. There's a lot that plays a role in terms of looking into other data. Often when I'm on consults with clients and our doctor, we'll also cross-reference other blood work to see how, your basophils and, now I'm trying to talk like a doctor and I'm not on that level.
Eosinophils can be
Right.
high, but when they're limited in your gut, or if your body's not even fighting them off anymore, like we've seen high parasitic load and the basophils and eosinophils are doing nothing. They're essentially, and that happens when the body almost gets inundated and it goes, I can't, because if I fight off all this, I create too much of an inflammatory response. The vagus nerve's going to go crazy. I'm going to be in, and it backs off. So it's not even like, you can't even count on those half the time. And it's got to be pretty acute for those to be elevated half the time. So that's what we see.
Got it. Yeah. Well, I love the approach. And then, I'm sorry, obviously you've gone through it personally, but obviously it's probably made you stronger and given you so much more information to be able to help other people. So that's fascinating. What are for you, besides healing internally, like the gut and killing off the bad and detoxing and all of that, are there any particular therapies, habits, hacks, strategies, et cetera, to stimulate the vagus nerve that you personally practice yourself and or guide others on? I'm curious.
Oh yeah, 100%. And that was like a huge part of my healing, is you're trying to get the vagus nerve activated to regulate the immune system, to calm you back down so that you can get into a healing state.
Right.
And it's really hard when you're in that state to try to meditate. You can try and do breathing, but the big key things for me were red light over my vagus nerve, which was hugely, like, at one point my blood pressure was like 200 over 100 because I ended up getting Lyme carditis the second time around. So that's when Lyme goes into the heart lining, and my blood pressure was wild. I had chest pain and all of that, and red light over my chest, over my vagus nerve, over my gut would bring that down to almost normal when those kind of flares came on. I use two different types of vagus nerve stim. One gets the auricular branch, and one gets the cervical branch of your vagus nerve. And
like
so,
electrical stimulation.
yeah. And so depending on what was going on, I would stim those, and sometimes the cervical one would help me better. Sometimes the one auricular means the ear branch, essentially. Your vagus nerve, cranial nerves run from your brain. They're cranial nerves, either from the brain or the brainstem. So the vagus nerve comes from the brainstem. It exits the skull with a few other of the cranial nerves. So you can use those to affect the vagus nerve as well, because they share the same fascia. But the vagus nerve comes down and becomes superficial in your ear. So there's a good place to stim it. Even I use acupuncture in the ear, can help the vagus nerve. And then it's very superficial at the front of the neck, and then it goes under your collarbone, and it goes to your to all of your organs, all the way down to your descending colon, and then your parasympathetic takes over in your sacral spinal nerves. So you can stim it here. Before I had the stim, I was using a toothpick because I practice acupuncture on my patients for years. I'm a chiropractor by trade. I got into functional medicine because of my own health problems. One of these attacks kind of happened to me on a plane, and I didn't have acupuncture needles, but I had a toothpick. So I started tapping acupuncture points with a toothpick. And I was able to get myself out of these like fight or flight states. I started using that with my patients, and I had one girl with seizures who, when she felt her seizures coming on, she could tap and stop her seizures from coming on. So that was like a manual stimulation of the vagus nerve, and then, these electric stims that, are more, the frequency specifically helps the vagus nerve. Those became really kind of a crutch for me. Um, Other things for my vagus nerve, like PEMF, massage, chiro, all of that, like body work is huge, because a lot of the times that you get symptoms, and a lot of the symptoms that come up from these infections, is because they stagnate lymphatics. So your lymphatics slow down. And, when a river's flowing, that's not when bacteria grows or algae or viruses, right? It's those little offsets where they sit and they can stew and it's not moving. And that's what happens. There's different places in our body that become these like sewage points, like these choke points. And that's where, if you know how to release those, so castor oil is a big component of body work with castor oil, specific acupuncture, just the simple act of going outside in the morning and getting morning sunshine on your eyes is activating for your vagus nerve. But if you tell someone in fight or flight, like I was, to meditate, it's not happening, right? So you need something externally to kind of bring you into that state until you can start to get there on your own.
Interesting. I did not know there were specific e-stim out there for activating the vagus nerve. I'll have to look into that. I personally finally pulled the trigger on one of these guys. Are you familiar with the Apollo Neuro?
Oh yeah.
Are you a fan of this? Have you used this personally or with patients?
I haven't used it with patients. I've got one myself to kind of trial, and then that's what I kind of base my suggestions on. So I need to get there. But I've been treated by someone who had it on, and I could feel it vibrating when it was trying to like calm them down. So
Right.
I definitely, I think anything that kind of interrupts that circuit that starts happening can be beneficial. And yeah, like I said, because if I'm tapping with a toothpick, or that's some people flick their wrist with an elastic, right? So there's different ways of kind of interrupting that circuitry from going down that kind of fight or flight.
Definitely. Yeah.
Anxiety.
I've got Calm on right now. I thought about Focus, but I'm having a matcha with some alpha GPC in it, and I think I'm pretty focused on. Sometimes for me, what I find, and everyone might be different, but like, and I've heard people talk about how like to have focus, you don't need more of things. You don't need more energy, more things to stimulate. You need less. And so that's something personally I'm trying to work on, and finding the calm, the power of calm to bring focus. Well, very, very interesting. Good stuff. So you, what, I want to come back around to the article that we were both featured in, on nutrition and working with pro athletes. Pro athletes, big part of your work. You're in Toronto, and we just recently expanded to Toronto, so we're now international, which is exciting. And we see a lot of different types of pro athletes from different sports with different goals, and I'm sure you do too. I'm curious, are there any specific trends that you see from athletes across the board, whether it's things you see in their data or things you see in their goals or their lifestyle, et cetera, that you've identified, and kind of what sort of approach, what does it look like to help them optimize in your clinic?
Trends that we see that some people, I guess, would be things to highlight that people don't understand is the athlete is performing at a high level, but it doesn't mean that they're really healthy. So that's something that we've seen for a very long time, because I've been working with athletes since I was for 14 years. I was sharing with them my story, and it was allowing them to be a little bit more vulnerable and share what's going on with their gut health or what's going on with their anxiety or, other strange symptoms that they are having. And I feel like sometimes you don't even get that story from them, right? So there's that whole being a man's man and not really just powering through things. Athletes in general are over medicated. They have too many surgeries that they probably could have just done with conservative care, but they, have more of a conservative approach on teams. They are traveling a lot. They don't always have access to perfect food or diet. They don't often know what a perfect food or a perfect diet looks like. They have the stress of media. They have the stress of being 20 and having old men looking up to them, or being obsessed with them. It's strange, right?
Sure.
They're in a microculture where they're keeping up with the Joneses, where they might be at a bottom salary and someone else is making $40 million. So it's an interesting demographic that we see some so they're pretty much kids with money that aren't necessarily always fully educated on, first of all, their body in general. And yeah, so some of them early on kind of figure it out and take their health into their own hands and, look for outside sources, sometimes because they have their own story, like mine. Like my whole outlook on medicine changed. I went to a very conventional chiropractic college. We learned more about pharmaceuticals than we did about natural stuff. We were very much, you don't talk about this because that's for the medical doctor or this. And so all of the way I approach everything is from my own problems, struggles that I've come encounter with, and seeing the way that they were dealt with improperly, and, not putting my whole trust into somebody because they're wearing a white coat or whatnot, or so I feel like, it's the same misconceptions with teams, that someone that works for a team is the best of the best. Well, I mean, it's not necessarily the case. So not to say there's not great people and but from what I've seen, care has to come from from the outside, because the team cares about, are you playing tomorrow? The team cares about, are you on injured reserve so that we have more cap space so that we can bring in another player? The team cares about the bottom line. You're a commodity.
It's
When
a
you leave
business.
when you leave that team, you now have a different doctor. So it's like they're caring about who's on the team at that time. I think it's very important for athletes to have their own separate care. And I think even their trainers, as far as treatment, because we treat people, they don't have enough time to spend the hour or the 2 hours that you need to work on all the body parts that make that hip go out, right? So I forget your question, but I'm just kind of
Oh yeah, no, you're covering what you see, and
yeah,
the importance that you're
yeah.
highlighting around the importance of having your own care team. And I'm right there with you, because I, as I wrote about in my book, when I 6-7 years ago, was all about how to take your health into your own hands, and that can be daunting and challenging, and there's a lot of misinformation, and but at the same time, you can't just place um, and assume that this one person that you've worked with before knows everything, and it's always important to get second opinions and different specialties and et cetera. So um,
I love working with people who are working with other practitioners who are willing to bounce ideas off of each other, or yeah, I've learned the most from those cases. It's your practitioner shouldn't be egotistical. They should be just wanting results for you.
right,
So we all have egos though, so that's one thing,
yep,
but being able to put it aside is something else.
right,
But I'll tell you, working with humans is humbling, because one thing you did for one person is not going to work perfectly for that other person. And so, what worked for me isn't going to work for every single player, or so it's a humbling position to be in. But the more that you allow yourself to just learn and be just my favorite people that I work with, I'm just the quarterback for their care. I'm listening to all their different care and I'm like, oh, okay, that makes sense. This is what I know about that, but and this is how it could be beneficial, but maybe there's this, like, so I think no one knows everything. And then the person that thinks they know everything are the scariest people, and you should run the other way. So that's what I think about them. But overall, what you see with athletes, like if you're talking about more literal stuff, is, if they went to a regular doctor, they'd be like, oh my gosh, your immune system's tanked. But meanwhile, when you're really active, your white blood cells go low because they leave circulation and they go into the muscles to heal and to clean up waste, right? So athletes are often in a catabolic state, and their white blood cells are exiting their serum a lot of the time because they don't rest very much. And if I created a schedule for athletes, it would look a lot different than what they have, to be honest, but I don't.
What
So,
would that schedule look like? I'm curious.
so there would definitely be way more rest days, and there definitely would be no bag skating or very little bag skating, especially for the injured people trying to come back to play. Like, I
You
don't
said
know.
bag. So this is a hockey term. What's bag? I'm
Yeah,
not familiar
sorry.
with
I'm like
bags.
90% hockey now. I used to work with golf and baseball and
Yeah.
NHL, but I mean NFL. Um, it's when they just skate them till they want to puke, essentially. So, I mean, working with the vagus nerve and knowing rest and digest, and when you've done a little bit too much, and the way the body heals and what it does to your immune system, I would say, and understanding that their immune system is already taxed just based on their sport, like athletes get sick more than the regular population. And I don't know if people realize that as well, too, because we can go into that. But um, so I think that teams should understand that more too, right? So like there's this whole bravado thing and it's like beat yourself up, or then there's like, they have a game and then they do a workout after the game. I mean, you don't need to work. No, it's rest, right? And like sleep is so important, and no one teaches them how to come down, right? So
That's something we hear a lot of is because we ask in their intake form, we want to know how they're sleeping because nutrition can support that and affect that. And so many of them say it takes a lot to come down from a game day. They're probably under a lot of blue light, artificial blue light, whether they're indoors or outdoors. They're still going to be under the
they're
blue
under
light.
it.
Yeah. The travel, what are some, how do you support the athletes you work with on relaxing and recovering and getting that nervous system ready for sleep after a game?
Yeah, well, it starts off with not doing a workout right after the game, but starting with nutrition right after the game. Right after you are active is the best time for your body to create new glycogen stores, to utilize energy in a good way to heal the tissue. So if it's liquid nutrition, it's a little bit easier. So within a half hour, making sure there's some good liquid nutrition that their body does well with. Different types of protein. We get people to rotate different protein shakes as well. Um, we have different plans for people based on their testing, but there's going to be some sort of glutamine or extra amino acids in there just to help build everything up. And then there's simple things like starting to drink tart cherry right after that to like, increase melatonin. We get them to nibble on different, we have different chewables that they can chew on that are things that help to calm their nervous system. Then we coach them on, again, yeah, can you put blue blocking glasses on right away after? Can you not go home and play video games until 1 a.m? Like, can you listen to like some calming frequencies? We have a lot of people buy different biohack things, be it a PEMF machine, be it different things to increase their oxygenation, like baths or water that does so. And then like have them help themselves, like not trying to go down with alcohol that will eventually bring up your cortisol. Even weed disrupts your sleep. So a lot of people use marijuana, and that's not really great either. Maybe CBD is okay for some, but everyone's different. So you find that little mechanism of calming and you help them. We do a lot of mitochondrial support after the game, which people think will give you energy, which it will in the day, but actually it helps them heal and relax. So
Can you
yeah,
give an
there's
example of that?
like a carnosine blend of different things like that. Um, can help. Usually it would give energy, but after a game when it's in the night, it actually helps to lower everything. And then we have different like sleeping chewables, different sleeping tinctures, different things like that that help. Again, there's not one that helps
Right.
most of them, although there's like one that does really well. And those are the insomnitol chewables, but there's definitely a lot that they don't realize they're doing to themselves that make them not be able to come down and
Right.
sleep and stare.
Alcohol. Yeah.
Yeah.
More blue light when they get home, watching movies or video games.
Mhm.
Even marijuana, you said, which, um, yeah. So I'm really curious about, the alcohol, and whether you're a pro athlete or not, plenty of people unconsciously or AKA, have an unhealthy, abusive, just like unconscious relationship with alcohol and marijuana, and I rarely drink alcohol myself. When I do, it's a nice clean whiskey or tequila actually after a workout, because I've understood that it can help maybe better digest the alcohol into your muscle cells as opposed to your fat cells. But then
Mhm.
again, like, is alcohol really healthy for you?
I mean, everything there can be small amounts of anything or that just create like a hormetic stress. Like
Right.
obviously when you're wasted or you're doing shots
Yeah.
on shots, like we all know that's not good. How do you feel the next
Right.
day? So I mean, obviously it's not good for you, but if how many people do you know live till hundreds and they drank a
Yeah.
lot, right? Because we don't understand every little tidbit and it depends on the person.
Right.
So if you're a super stressed person and you're doing that to try to shut something down and you're overdoing it, it's not doing something good for your body. Context, I think, matters. I think I learned that too, because I don't think anything is like inherently bad or inherently good or in general, except for there's obviously, I don't want you taking in any glyphosate if you could. It's banned in every other country, right? Like
Yeah, I
it's
didn't mention this, but that struck a decent chord for me. I'm from Iowa originally,
yeah.
where we have some of the, well, have had some of the best soil that has unfortunately been degraded over time. And, the Roundup, I think, even may have originated
Mhm.
from there, not far from where I grew up. So that's, we've actually, and that's crazy that you can actually detect something like glyphosate in stool testing. But
In
in
urine, sorry.
in urine
I
too.
was just
Okay,
saying that
got it.
it lowers everything. You can't see it in the stool test, but you can see it in the urine test. Yeah.
Got it. Okay, cool.
Yeah.
Well, so yeah, so post, I loved your tips overall on, post activity, post game recovery, the importance of, um, proper nutrition, liquid nutrition, perhaps is easily and quicker digestible, specific amino acid profiles, L-glutamine, those are actually key ingredients. And we have like a sleepy time recovery ice cream, which we got to have our chef drop that off for you to try
Yeah.
sometime.
I tried some of your stuff with one of the players that we mutually work with. That was actually in that article, so I guess I could name him. But
Oh, he brought you some things to try?
yeah, I tried some of your delicious baked
The
goodies.
donuts? Yeah,
Mhm.
the baked goodies are a hit. Tart cherry, to get the melatonin going. That's key. And then regarding marijuana, how many of your athlete clients are like, openly share and like are honest with like, that use, for instance, would you say?
With me a lot, but I don't see it as much in the NHL as I did in the NFL for sure.
Got it. Yeah. Yeah. I've heard NFL and baseball,
Yeah.
is often. I'm particularly curious. You talk a lot about the liver, and so edibles, when it comes to marijuana, have blown up. Right. I live in Colorado. They're
Yeah.
everywhere. I mean, I microdose a fair amount, on edibles, and I'm wondering how. What could be the downsides to my liver? Is my liver working harder? Is it hurting my liver? What have you seen, if anything, regarding edibles affecting, liver and liver health?
Yeah. I mean, obviously the liver has to process them, right? and then they're have to be like cooked in fat, and it has to go through that process. So, but it's not as like straightforward as like you drink alcohol, you have formaldehyde. I think over time it could be more, but I'd say the biggest problem I see with weed and marijuana, and even smoking it, but also like when you eat it, is okay. So you have to understand the marijuana plant and a hemp plant, those things were planted when there's nuclear waste. So say there's nuclear waste somewhere and they want to clean the soil, they're bioaccumulators, right? So they absorb a high toxic load. So if someone uses them for that, they're very easy for them to be contaminated. So I actually saw this because I went to a lab in LA where they showed the toxic profile that comes up in marijuana. So you want to be really careful of your supplier, which maybe you are. And then you take away all those things where it's not all these industrial chemicals that your liver's detoxing, right? So I'd say like the cleanliness of it is going to be, because like CBD, like the active ingredients, THC, I mean, we know that they have some benefits used in certain ways, right? So again, it comes back to like, so they're different chemicals that our body recognizes a little bit more, right? We have our own endocannabinoid system, right? And then the way that something comes in a plant, it's balanced with their THC and CBD. And I know they play around with it a little bit, but I'd say more worrisome is like how toxic is the plant that you're now taking in, right? Is it,
Yes.
because there are ways to like clean the product, but it's very hard these days for it to be very clean because of just how toxic the world is.
Couldn't agree with you more. And I'm trying to be better at that myself. A lot of people say, oh, the best way to do it is grow your own. And, and if not, buy organic wherever possible. And, maybe even making your own edibles, which I just, I recently made a little,
Yeah.
grass-fed ghee simmer with some organic flour and
I mean,
yeah.
you definitely have the capacity to do that. I would not.
Yeah. different.
I need to hire companies like you to cook for me. Like I did at one point when I was single. I'm not the chef person, that's for sure. I wish I was.
Yeah. Yeah. Well, great. We've certainly unpacked a lot of good things here. I'm curious, on the what would be maybe some of the other things that we haven't covered yet that you would feel like are really important. Overall, our listeners, a lot of pro athletes, will share this to our Elevated Eats network. A lot of entrepreneurs, a lot of just overall high performers that want to get a lot out of life, and managing stress, optimizing health, longevity has the buzzword these days, and anti-aging, so
Yeah.
how for those that are kind of gotten bit by that kick, how would you guide them, and what sort of other strategies or your big vision view would you impart some wisdom for people on?
I mean, I would start by getting interested in your own biology, because these things should be so interesting to everyone, because like it's your actual body. Like some people find they just want you to tell them what it is and do it. But when someone understands what you're actually doing, like that's when you get these big results. And I've had players who came to me really sick with the same symptoms that I had, with the heart, with the nervous system, with the pain in the organs, with the blocked valves in their gut where accumulation of toxicity. And once we get them into health, and then they're interested and they know why they're on every single thing, and then they start to build from there, and now they're healthier than they've ever been and probably ever would have been, because they ask questions now and start to play with I don't know how to get people to there when they're not naturally inclined to do so, or don't have this like crazy health thing like I did. But I think, like you said, it is becoming more interesting to people. So I would say, first of all, the basics. You talked about light. We talked about light. There's toxic health, like your home health. Okay, so there's one thing. Where do you spend most of your time? Get it as healthy as you can be. Like I didn't mention when they're traveling, the biggest thing that I love talking about, which is 5G, because I became electrosensitive at the time. And also it was when 5G essentially got rolled out that all of my symptoms kicked back up. So what we learned about 5G or what I learned based on that was that there's studies on animals showing that it affects your heart in a negative way. It increases voltage gated calcium channels. You get an influx of calcium. So if anyone's had a heart attack, you get put on a calcium channel blocker, and that's to slow your heart. And if we're talking about concerns with athletes and you're not concerned about how many athletes have dropped dead from cardiac events, then I mean, I'm very passionate about educating on that. And I think there's obviously been COVID, there's been a novel medical intervention introduced that has been highly toxic. There's been a highly toxic virus that was introduced to the population. But also at that exact same time, they turned on a whole new man-made technology.
Right.
That technology is not a radio wave that we are used to that has been harnessed. That's what 4G was. But 5G is a direct wave of toxic energy frequencies. So in medicine and in what I went through, you can put a frequency on your body and you can kill a parasite without taking a single thing, right? We're frequency beings. We have electricity is what makes our heart beat. Static electricity is what makes our lymph move in our body. So if you introduce something that acts almost like a laser to humans and you don't think it's going to affect their health, then you're crazy. And if you don't realize that athletes who are under even 5G plus, which is they've taken part of the wave out and made it even more direct, then you're not catching that these healthy people are dropping dead and people are dying in their sleep and all of this, then I mean, I don't know, like wow. we're out of luck. But that's been like a big passion of mine because my heart went crazy out of nowhere. And I was in Las Vegas where there happens to be just a whole shit ton of 5G. And I was electric. My hair was standing on end. My heart rate was through the roof. I was having palps. Now, what are palps? That's wrong electricity.
Heart palpitations.
Yeah, heart palpitations. So, and I have never heard so many athletes complain about heart palpitations in my entire life. And then we do a little bit like deeper dive into their like what's going on. And then I had this aha moment because I saw this study. 5G, when it's exposed to mold and Lyme and other pathogens, makes it more pathogenic. We all have mold in our body at some point, right? We all get exposed to mycotoxins. If we had mold in our home, but now there's 5G, it shows it's 600 times stronger, 600 times more toxic.
That combination of 5G with mold or Lyme.
Yeah. So now picture in 2010, when I first got sick, right? Things turned on an infection, but it was at bay for all these years. Never haven't had a symptom, was feeling what I called like the best I had in my adult life. And then boom. Well, if something's in my body latent and now there's an exposure to my body or a frequency that makes them stronger in a way or give off more toxins for whatever reason, well, maybe the threshold of my immune system that it could keep at bay got tipped over the edge. And then that was that. And maybe that's a combination of things. And but anyways, so you have to look at the external thing. Now, I work a lot with NHL players. Right. Rinks are moldy. Their equipment is moldy. Mold, we've always worked with people with mold. It affects your heart. It affects your anxiety. It makes you toxic, have toxic thoughts. It makes you have pain in your body. It makes you chronic fatigue. So, hello, like we've got to.
And you NHL, is that because you see it? And I know you mostly just work with NHL players. So maybe it's harder to compare to other sports, but because of the presence of like the rink and the moisture, is that maybe why you're seeing higher amounts of mold?
Yeah, but it's not just with them. I mean, golfers have a whole other plethora of issues. They're working on pesticide all day.
I was going to say.
So there's like, I mean, I did the urine tests of some golfers and it was wild, the toxic load that you see. And like, I mean.
And football players playing on turf, affecting testosterone.
Yeah. I mean, they all have individual, there's commonalities just from the lifestyle. And then there's like their specific things, right? Different root causes, so to speak. But I mean, some of them live in Florida. There's so much mold in Florida. Like, so it's not like you see trends, but I mean, if you're to look at health and what can cause your health to plummet, I mean, there's only there's not that long of a list of things. And I think we need to get really a lot better at like being able to show what those are, or have people that are in powerful positions accept that those are causes. Because I can tell you, felt like I was dying, and now I feel healthy again. I mean, if I went to the doctor, I went to emergency at this time because my heart was going crazy and I thought I was dying. And I'd never had a cardiovascular symptom in my entire life. Even in my first Lyme, it was all neurological. And I go there, and they send me home because my palps are what they call benign, even though I'm having heart pain, even though my troponin is elevated, which is a heart attack marker, but not elevated enough to be a heart attack, but elevated enough to show there's damage. I have my white blood cells, which are supposed to be between like 8 and 11, at like 17. My neutrophils are clearly fighting something off. And I got told to go home, not drink coffee or have chocolate or any other stimulants because I was perfectly healthy. They told me it's 4 a.m. in the morning. I haven't been to the hospital in 10 years because since my other thing, and that's what you have for me, because like I don't, and I'm like, well, am I not fighting something off right now? And anyway, so it's just like,
I have a similar emergency room story. While I was writing my book in Iowa, I was out to brunch with my family, and I collapsed on all fours on the ground, and I went in and out of consciousness, and um, rushed to the ER. You know, they had no answers for me, but it was extreme dehydration. I was keto, overworking, pulled out a lot of hydrating foods, and so yeah. Anyway, so yeah, they're not great. They
not to
might be
mention,
great. Yeah,
yeah, not to mention my electrolytes were wonky, and that's what we've been seeing. If you're talking about trends,
yeah,
seeing a lot of that.
yeah,
Mhm.
yeah. My sodium was in the 120s.
Yeah, you had the
Um,
keto flu
which
essentially.
is super low. Yeah. And that, which obviously, that affects the heart. And that's crazy. So hearing from you talking about like the effects of 5G on health in 2021. Yeah. I mean, right when, the whole pandemic and virus came out, I mean, it was interesting because at the same timing that 5G was rolled out. I read a book during the pandemic. Maybe you've heard of it, called I think it's called "The History of the Electrification of the Earth." Or no,
Yeah,
that was the subtitle. The main title was called "The Invisible Rainbow."
physical rainbow. Yeah, yeah.
You know the
I've
book.
read it multiple times because I find it very, very profound.
Oh my
And
gosh, it is so eye-opening and awakening in terms of how over the last few hundreds of years we advanced technology, and health issues follow.
yeah, exactly. So, I mean, and that's when there were different pandemics, and it's all like you cannot make big, huge changes in everyone's environment or in something that you inject into someone and not think that there's going to be repercussions. Like, but to not be prepared for them, because I think that of course they knew that does this. There's got to be smarter people than you and I running the world. I don't know. So that means they knew about this, or maybe not. I mean, maybe that's another generalization.
Exactly. It's one or the other, right? And either way, it's not good.
Yeah,
Yeah.
yeah. So I don't know. I feel like there's an answer to every problem, and
Yeah.
we're just having to rough it to find out. But I think
Mhm.
the human that wants to fight for their health and well-being finds the answers,
Right.
right? Because I could have
Takes.
easily given up and felt like I wanted to die. I'm not gonna lie. But that's how bad that these things can
Oh
feel.
yeah, and to be able to have your own agency, and it's the empowered feeling of like, oh, I can take my health into my own hands, while also building a badass all-star healthcare team, right? And that's what I've always found for myself personally. Like that's the best balance. Works really well if people can surround themselves with great people, and build their own internal motivation to continue to take take strides in their own health. Um, well, yeah, and I guess one quick comment, I guess, and if you have any other particular strategies for travel and stress with environmental toxins and EMF, et cetera, I'm curious. I do have a good friend, just for what it's worth, in case you wanted to look into it, that throughout the states, Um, they do EMF assessments of homes, of offices, and Brian Hoyer is my buddy's name.
Yeah, I know him as well.
Oh, you
Like
do?
we've chatted. Oh yeah,
Cool,
Nick
great.
know Brian Hoyer. There's the Test My Home guy, Ryan.
Yep.
There's Brian Blazer. There's a guy in Toronto,
That does
Mike.
some work too.
There's like it's becoming any home biologists, they learn about the detriment of and then some people just take it to a whole other level, but there are ways to protect yourself. We did come up with an EMF guide based on what helped me even in the acute stages.
Oh,
So
cool.
maybe we can offer that at the time that the podcast comes out.
You bet.
But we put a lot of work into that based on a lot of research and a lot of what I saw helped myself become less and less electro-hypersensitive.
Right.
But that's a real thing too. And so, yeah, just if people have felt changes in their health, like to a huge degree in the last 4 years, like, and they don't have answers yet, I mean, these are some of the places to look. There's also like, obviously people are calling it long COVID, but I believe that the COVID is creating the inflammation that stirs up other hidden stealth infections. So that's a big thing that we test for people and eradicate for them as well, or help their own body, because essentially you never kill every parasite, you never kill every bit of Lyme. Your immune system has to take back over. You're giving your body a little bit of help and you're removing some of the things for it, but ultimately your body has to come back to homeostasis. And so there's the vagus nerve is one of those ways to access, because there's a big vagus immune connection.
The vagus nerve, the power of the vagus nerve, led by the Vegas Clinic. Dr. Stephanie, it's been great to have you on the show to really unpack all these little nuances that play a role with healing and health and performance. And so if you're listening to this, I strongly recommend you look into the work that Dr. Stephanie and her team are doing. We'll definitely have follow-up information for people to look into how they can work with you. If you want to briefly comment a little bit, I'm not sure if you can do any virtual work, or is it all in person, or is it a hybrid, but like share a little bit about what could be some good next steps for any high performer, any athlete, et cetera, that wants to take things to the next level.
Yeah, I mean, we do virtual and in person. We think that the blend of it helps the most if that ends up working out. I mean, my idea is to start to train people on the actual novel soft tissue stuff that we do for people, including like really clearing the deep lymph, which a lot of people do not really address. And again, had to suffer greatly to uncover the power of that. Because like, I do think that's important, but obviously we can't see everyone in person, but we do take virtual. And yeah, we're at vegasclinic.com or Vegas Clinic on Instagram, or mine's Dr. S. Canestraro. So you can find us there, and we're starting to do a lot of more like free resources and things that have really helped. So we're really dialing in there.
That's amazing. Awesome. Well, appreciate you and all the great work you're doing in the world. And I know all the athletes do as well. They need a great team around them, outside of their own team that they play for, to really support overall health and longevity. So keep up the great work, and we can't wait to hear how our community responds to the interview.
Yeah, thank you so much.